Good afternoon and welcome to the sixth meeting of the Commission on Race and Access to Opportunity. We have a robust agenda today that's going to provide for all of our members the opportunity to do what we refer to on the agenda as discussion and wrap-up of the 2021 interim. Certainly before we move through the process, though, we will ask our staff to call the roll.
Senator Berg.
Present remotely.
Senator Neal. Senator Westerfield. Representative Brown.
Present, 77th District.
Representative Cacarney.
Present in the room.
Representative Timoney. Jameer Davis. Hannah Drake. Ricky Jones. O.J. Oleka.
Here.
Erwin Roberts. Chair Givens.
Present in the room.
Chair Heverin.
Present in the room.
We do have indication that Senator Westerfield will be joining us remotely here in a few moments, and it appears staff alerts me we do have a quorum, so it would be appropriate for us to go ahead and adopt the minutes that are in your packet. These are the minutes of the fifth meeting date of October 2021. Chair will entertain a motion for adoption of the minutes.
So made.
We hear a second.
Second.
Motioned and seconded. All in favor of adoption of the minutes, say aye.
Aye.
Any in opposition? Hearing none, motion is approved. Minutes are adopted from the October 20, 2021 meeting. First item on our agenda, Dr. Terry Brooks, Doctor, Director, Executive Leader. Please come on up to the table. Mr. Terry Brooks, it's always a pleasure to have you here representing Kentucky Youth Advocates and your presentation of the Kids Count results. And I think you have some people joining you. I would ask that all three of you identify yourselves for the record and please proceed with your presentation. Make sure your microphones are turned on. Microphone on means you see a green light.
I'm Courtney Downs.
Now? Okay, got it. Okay.
The green light, Terry,
I got it. Yes, sir.
It's kind of green.
It's kind of confusing.
Kind of a green.
I'm not good at technology. Thank you so much, Senator Givens, and also Chairperson Heverin. We appreciate you making this possible. Our hope today, and actually this homework assignment was given to me by Senator Givens in September. And he talked about that you all will be receiving a Kids Count book, and what he challenges us to do was think about what the data in that book suggested around policy change. I went back, Senator, and the very first meeting as chairperson, you opened by saying, my light bulb moment is that this commission has to be all about policy. We could not agree with that more. So knowing that you do not want to stay here until 6 p.m. on this Tuesday before Thanksgiving, we will not do a comprehensive policy look, but rather our goal is to highlight a couple major areas of focus to plant what I would call a cerebral itch. We really are anxious to work with you all as the 2022 session opens, and we want to highlight some policy implications that you can extrapolate from the Kids Count book. Just a couple notes on the Kids Count data this year. I think most of you know that Kids Count is seen nationally as sort of the gold standard for report cards on kids. And what jumps out at us this year, because we did a deep dive into racial disparities, is first of all, as all of you on this commission know, the issue that racial disparities in the Commonwealth are so clear as a result of historic and structural and institutional practices. That leaps out. The second thing that I would just emphasize is that when you look at the demographic disaggregation, you will see that that is an issue that should concern folks in all 120 counties. We know that the tendency is to think that issues of racial disparities tend to be isolated. When you look at county profiles, you'll see that that should be an issue in all 120 of our counties. The other thing, before we get into policy, that I just want to highlight that I find fascinating, this is not the first time you've heard it because, Senator, you know some of your colleagues frequently talk about this. The most vulnerable two populations in Kentucky seemingly are so different. It's those young people in the sixth poorest southeast Kentucky counties and kids of color who live in Fayette and Louisville. Ironically, the data and the disparities for those very, very seemingly different groups of young people are identical. What that suggests to me is that we should have hope because policy solutions to address disparities of zip code and disparities of race actually share a common ground. So what I'd like to do is suggest three categories of policy that I hope you will look at as a commission and then both the Senate and House as we go into 2022. I've asked Mahek and Courtney to dig deeply into just one policy area each to sort of give you a full brush of what we're talking about. The first kind of policy that I believe is on the table is what I would call low-hanging fruit. And I'll give you an example. And Chairperson Heverin, you participated, I think, a week ago in one of our forums along with Representative Cole Carney. And a quote that you gave us that day is so apropos to this particular typology of policy. You said, you know, we've got to be able to have data before you can create good public policy. And sometime that includes putting that into statute around collecting data. There's nobody who has been talking about that premise longer than Senator Westerfield. And we really endorse the idea of the General Assembly thinking about what data needs to be collected as a state. We know, based upon NCSL as well as ALEC, that many states have adopted a uniform data collection process. They have made sure that there are common demographics measured, common disaggregation metrics used, common focus, and a common timeline. As Representative Heverin said on that forum, unless and until we as a Commonwealth can count on accurate, timely, and common data, it has to be tough for you as legislators to know what's true, what's not, what's just anecdotal, and what's backed by evidence. So an example that we hope you think about are what opportunities are there that surely your colleagues share with you. Surely they recognize that that's a piece of low-hanging fruit. The second typology of policy that I'd like to suggest you think about is if this commission, working with the General Assembly, can be a catalyst. I mean, think of that as seed investment or venture capital investment. And I'll give you an example of what we're talking about here. We could pull a data point from health, education, community, and home. But what I want to focus on is economic well-being. This year's Kids Count book paints actually a positive picture of the trend line around childhood poverty. We once again this year show a reduction in that data point, and we should celebrate that. Now, I'm sure all of you agree that if there's a single kid living in poverty, that's one too many. But we do need to recognize that our state level right now is 21%. That is a historic low, and we need to celebrate that. But underneath that story is a different look. And that is that those young people in those 6 Appalachian counties and black youth in Jefferson and Fayette County have a 40% rate of childhood poverty. Statewide 21, those 2 groups of young people are almost double that at 40%. The opportunities from unprecedented federal funding are there to be a catalyst. 2 ideas that I would ask you to consider, and they're duplicative in many ways, so I don't necessarily expect you to do both. But we've been talking, and Senator Givens certainly has been part of that for a long time, about the impact of a state-level earned income tax credit. We know that the business community has analyzed that, and on a national basis, states that have done that, that's a real poverty fighter for families. It actually puts money back in the local economy and ironically builds the state budget. A policy that would dramatically address racial disparities around poverty, as well as those zip code disparities, is an earned income tax credit. Or if we were to tag on to the recently passed bipartisan part, I might add, of the federal relief package, the child tax credit, we know that 93% of kids in Kentucky are being impacted by that. The best estimates we see is that just that first year of that tax credit has the potential to reduce childhood poverty in Kentucky by 49%. Imagine if the General Assembly used those unprecedented dollars to be a catalyst. And I understand issues of sustainability. I understand long-term looks. But it could be a real jump start to tackling childhood poverty in Kentucky. So low-hanging fruit, policy as a catalyst. The final thing that I would invite you to lead the way in is what I would call boundary-spanning policy. There's a recent study out of Michigan State that talks about state legislators, not just in Kentucky, but nationally. Policy tends to drift towards supporting trends that are dying, established, and what they call boundary spanning. As you would guess, that study says that the toughest policies for legislators to pass are the look-ahead policies, the canary in the coal mine data points. And I want to just point out that there are several of those within the Kids Count report this year. The one that jumps to my mind is a distinct rise in out-of-school suspensions. Senator Givens knows that I'm an antiquated, broken-down, retired school administrator, so that drew my attention. And we know the good work that you all have done around the School Safety and Resiliency Act that Representative Carney and Senator Wise led a couple years ago. That could be a real jumping off place to get ahead of the curve. We know that those out-of-school suspensions carry a strong racial disparity to them, as well as an economic disparity. And again, we would invite you to look at that Kids Count data and think about what signals do you see of coming trends, and what policies could we promulgate to mitigate trend lines before they become present. So whether it's that low-hanging fruit, or being policy as a catalyst, or using policy to tackle boundary-spanning trends, we're counting on you. And we appreciate the commitment and focus that all of you have been giving this topic. Just going back, and that's what Mahak and Courtney are going to do, we could not agree more strongly with the 2 co-chairs. Senator Givens was right on when he said that this commission needed to be all about policy. And Representative Heverin was right on when she asserted that good policy has to depend upon good data. So here are 2 examples, we hope, of important data suggesting important policy initiatives in 2022. Mahak?
Thank you, Terry. And as Terry mentioned today, we want to highlight 2 solutions that we hope can move you as legislative leaders and leaders in the community from simply reading data on the page to truly transforming the future path for each Kentucky kid, especially kids of color. The health and well-being of children is on top of minds for families and leaders alike as the Commonwealth continues to address the ongoing impacts of the COVID-19 pandemic. Yet, in Kentucky, race and place too often impacts a child's health outcomes and their ability to access health care. Kentucky has taken several steps in the recent years to make it easier for families to enroll, which has led to vast increases in the number of children with health insurance. And Kentucky can continue to promote a healthy life for every child by ensuring parents have access and children have access to health care that they need. Kentucky's outreach and enrollment efforts for K-CHIP, which is Kentucky's health insurance program, as well as Medicaid, have resulted in 96% of children having health coverage. And these programs have been key in keeping kids covered during the pandemic, as some parents have lost employer insurance. K-CHIP and Medicaid ensures that low-income families can access health coverage that allows them to visit a healthcare provider or utilize telehealth services for physical, behavioral, oral, and vision healthcare needs. And while efforts have worked to connect many parents and kids to health insurance, we must close the gaps on the gaps that remain for Latinx children. As you could see, the health coverage rates by race and ethnicities, disparities do exist. Latinx children with only 91% insurance compared to black and white children from 97 to 96%. And if you flip through our Kids Count data book to see child population by race, you'll notice that there isn't a single Kentucky county that doesn't have Latinx children. And as a Commonwealth, as we look ahead to the upcoming legislative session, we must prioritize in closing the remaining gap for health coverage for Latinx children by increasing budget investments to conduct outreach and enrollment within the Latinx population, by using culturally relevant messages, trusted messengers to dispel information and to share the importance of and how to access health insurance to stay healthy. Kentucky can also promote culturally competent care by ensuring patients have access to translation and interpretive services in all healthcare settings to help families feel welcomed, listened to, and engaged in their healthcare. Additionally, we as a state can reimburse Medicaid health providers for providing professional language services. That's currently not happening. This is an allowable claim by Centers for Medicaid and Medicare Services, and Kentucky can receive a 3-to-1 match for the service. This can close a gap in the quality of care received between patients with limited English proficiency. Lastly, as we're looking into long-term solutions to achieve the full potential for a healthy life for every child, we must guarantee that families of colors as well as rural Kentuckians have sufficient health care providers in their communities. So that means we must build a pipeline of providers and also improve access to those providers. So I think we could all agree that every child in Kentucky deserves to have a healthy and hopeful now and into the future. Courtney?
Thank you. So I just want to, can you all hear me? Okay. Okay. All right, can you hear me now? Okay. So I do want to start just by saying that there has been a lot of really good work that's been done over the years to improve the juvenile justice system and how we respond to young children when they get in trouble. But there are still a lot of areas where there are racial disparities that have persisted, and one of those areas is among young children, specifically those that are 12 and under. And just to kind of frame this presentation for you all, if we look at the estimated total youth population for kids that are ages 7 to 12, Black youth make up 11% of the population and 20% of all of the complaints that are filed. Latinx make up 7% of the population and 5% of the complaints. And then white youth make up 80% of the population and 67% of the complaints. And when I say a complaint, that is just the juvenile equivalent to a police report being filed against an adult. And children of any age in Kentucky can have a complaint that's filed against them. So when we look at the type of complaints that are filed, the majority of them come from law enforcement at about 60%, and then there's another 27% that will come from, or 27% that come from school officials, and then there's smaller numbers where parents or the victim of an alleged crime have themselves. School-related offenses also make up the majority of the complaints that we see at about 53%. And when you break that down by race, that accounts for 38% of all the complaints against Black youth, 51% for Latinx youth, and then 58% for white children. And then just to kind of step back a little bit further and kind of look at the charge levels as well that we see just among, again, this 7 to 12 age group. The vast majority, at about 70%, are for minor offenses or for offenses that would not be considered crimes for adults. So 21% are for status offenses. And as you all know, status offenses are actions that are only prohibited because the person committing them is under the age of 18. So the two highest that we see are truancy, and then also those out of or beyond control. 49% are for Class A or B or misdemeanors, and then 22% are for the lowest class of felony, which is a Class D, and there are very, very few cases above that. Just thinking also anecdotally about some data that we've heard as well with this age group, we know that kids 7 to 12 who are involved in the juvenile justice system are more likely to have an IEP or be enrolled in some type of special education in their school. They're much more likely to be involved in the child welfare system. I think there was a presentation that was done by the previous DJJ commissioner, and she found that over 70% of the kids who were in detention at that time had experienced 6 or more major life traumas prior to their incarceration. And then we also see much higher rates of diagnosed mental health challenges. And again, this is for kids that are like 12 and under. And so for us, that just suggests that there were opportunities to better serve kids earlier on. So in dealing with their special education needs or any traumatic experiences that they might have gone through, we could have prevented the offenses from occurring in the first place and better served them at the same time, because we know that young children especially are not going to be as well equipped as adults are to actually face those tough challenges without additional support. And research, again, has consistently shown that young children, the younger a child is when they first touch the juvenile justice system, the more likely it is that they will recidivate later in life. We also see that they're more likely to have some of those negative long-term consequences that can impact their educational outcomes as well as their physical, behavioral, or mental health outcomes as well. So again, I know that's a lot of information to throw, but that also for us really just highlights some of the opportunities that are there for early intervention. And so one of the policy solutions that I wanted to share with you all is establishing a minimum age of jurisdiction for children who are at least 12 years old or younger. Kentucky is one of maybe about 22 or 23 states at this point that doesn't have an established minimum age, which means that children of any age can have a complaint that's filed against them and can have a case brought before a judge. And when you look at data from the past couple of years, the youngest children were 7 and 8 who had complaints filed against them. So we do see very young kids. And again, we see the racial disparity here as well. If we look just as an example at Jefferson County, Black youth make up about 29% of their youth population and 68% of all the complaints that are filed. So by establishing a minimum age that a child can be charged with an offense, especially status offenses and those other lower level misdemeanors, things that don't kind of threat to public safety, they can instead be referred to age-appropriate community-based services and resources that can actually assess what their needs are and then meet those needs specifically and provide support for their family as well if that's something that they need. And then another solution is just expanding or implementing some school-based interventions like restorative justice. Again, we know that a sizable percentage of complaints come from school officials or they're for school-related offenses. So we're more likely to see better outcomes for public safety and for kids in terms of completing high school and later in their futures if we shift our understanding of appropriate responses to disruptive behaviors or negative behaviors in schools, from criminal to more proportional discipline. And recent studies have shown that restorative justice practices in schools can be both proactive and responsive. It can help nurture those healthy relationships, repair harm, transform conflict, and really improve social interactions and the school climate more broadly. And it just presents a unique opportunity also for young people to take full responsibility for their actions through these facilitated conversations, and gives school staff additional tools to make sure that they're supporting kids in the needs that they specifically have. So when it's used effectively, it's something that can actually act as a primary prevention and kind of disrupt this path or this pipeline for young kids to detention.
Thanks, Courtney. To summarize, we would just emphasize, first of all, we appreciate your focus on policy. Secondly, I think Senator Givens and I see Senator Westerfield, they probably more than anybody on the committee know that we are pragmatists. We understand the load that you all bear as legislators coming into the session. But I would be remiss if I did not emphasize that we really do believe there are a myriad of policies that create common ground, that are eminently feasible, and can make an immediate impact when it comes to racial disparities on kids. Whether that's the typology of policy, that low-hanging fruit, being a catalyst or boundary spanning, or whether it's looking at the Kids Count data book and saying we're going to focus on a policy in each of the 4 domains: economic well-being, health, education, family, and community. Those are viable ways to begin. Again, we've learned through the years from folks like Senator Givens that early wins create long-term momentum. And that, more than anything, is what we hope we can see out of this commission, that the 2022 session begins to act as a catalyst, begins to create momentum to address disparities through common ground, common sense, and common agenda items. We appreciate the opportunity to appear before you today. We want to be respectful of your time, but we certainly would welcome any questions or conversations.
Well done, friends. Thanks for the presentation. And certainly, as colleagues consider questions, I want to ask one or two. And I'm going to start with actually a platform for you to use this again for just a moment. Many of us that are familiar with the legislative process and have been here for a couple of years and engaged in that process are quite familiar with the Kids Count book and the quality of the work that goes into this. We have some members of this committee that may not be familiar with this because we are not only a bipartisan, but we are not solely limited to legislators here on this committee. We also may have some folks online watching that have never had the chance to physically touch the Kids Count data book. So share briefly some background, if
Sure.
you would, of how we've arrived at this place of annually getting this very robust data set. Qualify for individuals online that want to find a way to access this data. They can go to a website and do some really neat things on looking at data
Great.
down to a fairly granular level. So Terry, take a moment and share that with
Sure.
folks.
Thank you so
please.
much for that question. Some 3 decades ago, UPS began asking the question, how are kids in America faring? And what they heard were anecdotes, opinions, and stories. If you know anything about UPS, you know that they are not interested in data. They are obsessed by it. They really want to know how long it takes that package car driver to get from the vehicle to your front porch and back on the road. So they commissioned one of their philanthropic arms, the Anna E. Casey Foundation, to invent a report card for America's kids. And each year, the Casey Foundation, located in Baltimore, partners with an affiliate in each state. KYA is Kentucky's Kids Count group. And in June, a national report is issued, which essentially ranks states. So this past year, we learned that Kentucky was 37th. I know many legislators, depending on where they're geographically located.
Pause a second. When you say Kentucky is 37th, expound.
Sure. The Kids Count Index report card has 4 domains: health, economic well-being, education, and family and community. Each of those domains have indicators. And so that ranking, composite ranking, is really just adding up where every state fared on all of those, and we came out 37th this year. What we tend to do with that is, not that we're not interested in Connecticut and Oregon, but I'm interested in Tennessee and Indiana and Ohio and West Virginia. So that's how we look at that. Then, as Senator Givens just noted, each fall, late fall, this just happened, I think, last Wednesday when Representative Cole Carney and Representative Heverin were on our forum, we release a county-level book, and we take that national kids count data, multiply it many-fold, and we do one other thing that we think is so important. We disaggregate every data point by county. So it's not just a state look, it's a county look. And for legislators or folks watching online, you can go to Kentucky Youth Advocate's website. We have a highly interactive data center where you can construct profiles based on a data point, based on a county, based on multiple counties in a region, and that report really becomes customized. What we hope happens with counties is that not only do we give you the data point, but we give you a trend line. So you're able to look at your county on every indicator and see if it's a green arrow heading in the right direction, a yellow marking, meaning status quo, or a red arrow going down, meaning that things have gotten worse. So, Senator, you're exactly right that what we hope is that kind of granular data helps legislators, county judges, superintendents, mayors, preachers, and pediatricians all come together and think about policy, not just at a state level, but down to the county courthouse.
Great. Thank you for that response. I think my co-chair may have a question.
Thank you, Co-Chair. I have a question about the access to health care. I was kind of flipping through while you were talking. It said that 90% of Kentucky children are covered with health care. But I wonder, we've had a lot of conversations about the cliff effect, and I wonder if our direction should be more focused on kids that are kind of affected by the cliff. So their parents might not qualify for Medicaid. Listen, I told Chairman Givens, I was like, I'm still learning this insurance stuff myself. But so with Medicaid, do you think that's kind of where we should focus at?
Certainly. Thank you for that.
And make sure to turn on your mic.
There we go. I'll get a hang of it. Thank you for that question, Representative Heverin. Certainly. I mean, I think we need to certainly close the gap for as many kids as we possibly can, whether it's our Latinx children or it's that remaining 4%. We're at 96% of kids that are getting covered, and those families that are on that cusp of that cliff effect. So certainly, I mean, I think we should use every possible solution that we can to get there. And I think that outreach and enrollment for Latinx kids could be the low-hanging fruit that Terry alluded to. And certainly when we are looking at those families that don't qualify for Medicaid, we should deploy some other outreach strategies that we are creating some sort of safety net for those families.
And does this, are they able to access the health care? Is it like the Connect now?
Yes. So that is the platform that right now that they could enroll in for Medicaid. That is correct. And they could also access several different other benefits, right? SNAP, child care as well. So that is the platform that we're currently using as a state.
So I had and this is also kind of like a question for CHFS, but I think one of the things in being able to provide access to health care is having for the person that's working to get the insurance is to actually understand the process of it. And from my understanding with the administration moving to Connect, it's been very difficult. It's not user-friendly. They don't necessarily provide all the information on there that the person might need. And so I think that might be a step forward. That's not necessarily statutorily, but I think that's, as we're having conversations about these things, I think it's something that we make sure to include is, insurance is hard enough to understand no matter what your education level is. And I think wanting to make sure that we provide that for people in Kentucky to provide that knowledge. Something else I wanted to touch on, Dr. Brooks, is you had mentioned, I got lots of little notes here, for the childhood poverty, the state level earned income tax credit and child tax credit for Kentuckians.
Yes, ma'am.
And one of my concerns on that is just financial empowerment. And I think, for those of you who know my background, I helped establish the Financial Empowerment Commission along with Dr. O.J. Oleka when we were both at Treasury. And I think that there's an important part of that is that we're, because just if we throw money or give money at an issue, that doesn't always solve it. And really being able to make sure that the people who are getting the funds, we're able to help them with budgeting and financial constraints and making sure, just basic level things that they might not be learning. Because that's no longer something we learn at home.
Yeah. The great point. The one thing, if I can go back just real quickly, just to remind you, on the health front, and Mehek alluded to this, one of the things that we're so aware of is that whether it's supporting Latinx families with better access, whether it's providing schools with school-based health services, we have the potential, I just want to reiterate, we have the potential for a 3-to-1 federal match. I mean, whether that means that the superintendent in your home county, for every school nurse he or she hires, if we took down that match, they get 3 more. So I know as legislators, you have to really pay attention to fiscal accountability. That whole arena of kids and health, we believe, is ripe for federal drawdown. So I just want to emphasize that. In terms of the economic empowerment, actually, I think that, for instance, the Earned Income Tax Credit, that is why that has such an appeal. It should not be lost on us that the biggest supporters of the Earned Income Tax Credit, the first person who strongly supported it was Ronald Reagan. The last person was Barack Obama, and in between were both Bushes and Bill Clinton. So if you've got a tax policy that has vigorous support from those 5 presidents, that suggests that it's a real common ground. What we've learned, both state and nationally, we partnered with the Brookings Institute to do a study in Kentucky called The High Price of Being Poor. Kentucky families who receive an earned income tax credit. So it's really families with jobs, and they get to keep more of their money. That's really what it is. It's not a government check. It's we get to hold on to more of the money we earned rather than paying it in taxes. It would not surprise any of you that those families do not use those saved, in general, those families do not spend those saved dollars in offshore accounts. Instead, what they do is they get their car fixed at the local garage. They buy their kids clothes at the local store. They get the appliance at the local appliance store. So it is very much that notion of helping to make ends meet. So it's a great question, because EITC is not one of those tax measures where, quote, the government is giving you money. The government is allowing you to keep more of the money that you've earned. And we feel like that is definitely within that realm of letting folks be responsible, accountability, that empowerment to shape their own kitchen table economics.
Thank you for that. I understand tax credits and how they work.
Right.
Thank you for that synopsis of that, though. I want to make sure that we provide these resources to these people, because I do think, having focused on financial education, that's a really big part of it, of knowing how to spend your money and what's appropriate. And so that my concern isn't the lack of knowledge of a tax credit.
Sure.
It's they get the extra money. Are these families equipped to know? Yeah. I've spent a lot of time at our local food pantry, and that's a big conversation there. I mentioned that on the call last week, is setting budgets and talking about that. What can we afford? What can we not? Are we getting the best, bang for our buck? And I just think that's an overarching thing with poverty across Kentucky. And honestly, I mean, it's something we talk about as legislators. We've got to have a budget because we can't overspend, and it's just like your home budget, here in Frankfort. So I appreciate that.
It's also a great example, and so many of y'all are so good at this, that we know kids don't operate in silos. So again, given my biography, one of the things I would immediately respond to is your conversation that we're having right now. I wonder the implications for the education committees, because there was a day where Kentucky kids had financial literacy instruction before they graduated. Our work with young people aging out of child welfare system is stunning, that as kids age out to independent living, many of those children, as you know, they don't know how to set up a bank account. They've never written a check. When they get that first job, they don't know what to do with it. So, I couldn't endorse that notion of a full court press around financial literacy any stronger. I think that's a really important point that you're making.
Thank you. Do you have a question before I move to OJ?
No, go ahead.
Okay. I'm going to turn it over to Dr. OJ Oleka.
Thank you, Madam Chair. I've got 3 quick questions. I'll try to be as brief as possible. The first one is about poverty and kind of continuing the discussion that we just had. For the presentation in terms of the numbers of families in poverty, children within low-income families, how is income defined? And does it include government transfer payments? And just for listeners who may not be familiar with what that is generally, a government transfer or government payment is money that comes to you through the government where there's no direct good or service that you are doing in terms of procuring that. The earned income tax credit would be an example of a government transfer payment. Is that included in your definition of income?
I learned a long time ago when I don't know the answer to tell you that and say I will get back with you. So I don't want to misrepresent what that is. We can get the chairs an answer on that in an ASAP fashion.
Great. And the reason, again, why I asked that, depending on if those definitions have changed over time, I think it is really important for us to understand what that 20%, generally speaking, 21%, or that 40+% either in Lexington and Louisville for black students and kids, or of course those 6 counties for rural kids. I think we need to know what that means, because if it does include government transfers, then if you take those away, that number is actually probably higher. So that's important for us to understand. Now, on education and justice, the combination of those two, I'll turn over here to you two ladies. Have you all done an analysis on potential overlaps between the complaints filed against kids, those students, and the socioeconomic background of those students? Now, I want to ask that question again to be very clear. I'm not suggesting that if you are a kid from a low-income background that you are prone to criminality. That's not what I'm suggesting. But if we know that a lot of those complaints are related to truancy, for example, if you have a parent or both parents who work a 3rd shift and they're the ones who take you to school, maybe that's what's causing you to be late, causing some overlapping problems. So have we done that analysis at all?
Not that I'm aware of.
Okay.
We can check.
Yeah, and I think the issue, it's a great question. It relates back to that common data collection that I'm going to give Co-Chair Heverin credit for reminding us of. That becomes, I think, a locus decision from a district-to-district basis. Mm-hmm. There are some districts that don't just look at gender and race, but they look at free and reduced lunch status. Others don't. So my hunch is that neither we nor KDE can answer that, because I think the variability, it's a great reason to think about what questions would we like answered for all kinds of issues, and therefore what data needs to be collected.
Mm-hmm. And again, I think that's so important, because as we look at those different counties, again, the rural counties in particular, and black students in the urban counties, if we know that the overall challenge in terms of poverty is the same, if we're able to break that down and say, well, if you look at by race and by poverty, the high complaints typically come from students who have, again, an interaction with those two areas. Maybe it does, maybe it doesn't. But if we know that, then we know that the solution is likely to be more income related. And again, if it is something with truancy or transportation, if it has to deal, kids are acting out, again, maybe because they're hungry, as we know happens from time to time with low-income kids if there isn't food in the house. Those are different type of solutions. The last question that I'll ask relates to the policy suggestion in terms of a minimum age in which students would interact with the juvenile justice system. The suggested age was 12. So if you're not yet a teenager, this might be a provocative question, but is this really a cultural question in the sense of, are we saying, how do we view kids? Do we look at kids 12 and under as having the capability to be able to make good decisions with regard to their emotional state, particularly students or kids who may have experienced multiple areas of trauma? This is something my wife and I think about. We have an 18-month-old at home, so we think about how will we teach her to deal with something if she doesn't get her way. And if you're a parent and you're not in a capacity to do that for whatever reason, again, you work a different shift, you don't get to spend as much time at home, or there is trauma in the home, or kids see parents react a certain way, so then they go into school thinking this is how you handle problems. Is it a cultural issue? And again, I don't raise that question to be so provocative to say we should do one thing or the other, but if we know kids, or we suspect kids who fall into this capacity of maybe hitting before they talk through an issue, if we know that they're not getting that type of resource at home, does it then become incumbent upon the school district to provide that resource? I don't know, but I wonder, have we thought about these types of questions from a cultural standpoint?
Yeah, the great question again. The real expert about this issue is the chair of the Senate Judiciary Committee, who I see smiling, and he could probably illuminate that more than anyone. What our proposal reflects, I think, and again, if somebody on the screen wants to correct me, that person is welcome to do it, was really a measured compromise. We frankly took NCSL and ALEC language, very similar in terms of age exemptions. I think that the best practice nationally, and I think it's tough to implement, but the best practice really is built on individual assessment. We know that there are certain 8-year-olds who frankly are accountable, and we know that there are some 14-year-olds for all kinds of reasons that may not be. So in terms of from an academic perspective, if we could assess every kid, that is ideal. Just very candidly, what we tried to do was strike a happy medium in terms of a chronological age. That is not, in my opinion, the best, but it's good. So, it's that good is not the enemy of perfect. Again, there's somebody who knows a lot more than I do about that. So I don't know if other members are supposed to speak, but that's certainly what we've been working on. I would just emphasize that just last year, radically liberal states like Tennessee and Texas passed these kind of laws. So we're not talking about lack of accountability. We're talking about what's good for kids and good for public safety.
Thank you. Thank you, Madam Chair.
Thank you. I'm actually going to go ahead and kick it over to Senator Westerfield since he's been pretty active and smiling on the camera.
Thank you, Madam Chair. I really can't say any better than what Terry just said. I've toyed with and have had draft language of legislation that's drawn the line arbitrarily, I'll freely admit, at 10 or 12 or some other number. And there's no science that says that at this magic age that suddenly you've got some better understanding. You can go find that, I guess, but I wouldn't rely on anything you'd go out and find. There's probably somebody on the internet somewhere that's got some study they think is worth trusting in. But no one with any sense is going to pay attention to that. What Terry just said is right. We've got to assess each child. There are young children who, under those circumstances, with the offense that you're talking about, under the circumstances unique to that child and that child's development and that child's environment, should have an understanding or should have had an understanding, and you're going to find older kids that, because of those same factors, wouldn't have the understanding. We have brain science, and when I was a brand new legislator, I thought this was baloney, and I thought this is some crazy liberal nonsense that was being spread about brain science and adolescent brain development. But I've heard Dr. Elizabeth Kaufman with University of California multiple times give not a partisan speech or remarks from the left or from the right, but with scans of the actual brains of the children and the young people she's worked with and studied that show the brain is not fully developed until you're 25. And it varies by the person. You can't also draw a line at 25 and say nothing matters until then. As Terry just said, and this is the underlying point, we're not talking about and shouldn't talk about, can't talk about eliminating accountability. What we should be talking about is making sure that accountability is tailored to fit that youth and for the circumstances involving that youth and their development, what they understand, what they should have understood, and what kind of risk and consequence they appreciate and could have appreciated. If you draw the line as a practical matter, if you draw the line at 10 or 12, you're talking about single digits of cases statewide every year. I think that's right, Terry.
Yes,
and
sir.
ladies, you can correct me if that number, if I'm off in that estimate. But it's a really small number of cases, and obviously for those kids, it's a big deal. For the victims in those cases, it's a huge deal. But we're also not talking about enormous numbers of people, even if you were to draw the line as high as 13. But the point is not about where you draw the line. The point is how you respond to the behavior. And it's important to make sure that the kid, regardless of their age, has accountability and has consequences that are appropriate for their age and for their conduct and for their ability to appreciate the risk of their own actions. So I appreciate you letting me comment on that, Chairman, or Chairwoman and Chairman. Thank you both.
All right, up next, we've got Representative Nima Kulkarni.
Thank you, Chairperson Heverin, Chairwoman. Thank you all for presenting. This is an amazing compilation of data, and I echo Senator Givens, Chairman Givens' comments that if anyone's not familiar with it, they really do need to go and look at this Kids Count book. I had a specific question. I think, Courtney, you had spoken about preventative measures, restorative justice alternatives to incarceration, and kind of getting to these kids before they touch the juvenile justice system. So my first question, and I've just got a couple, relates to what current mental health specific resources exist for kids now, and where are the gaps, and whether those gaps are county by county or within county by zip code. What is the kind of breakdown in available resources and the gaps?
Yeah, I think one of the things that we've seen is that I think the gaps are like county by county. So there are definitely places like Jefferson County that feel like they're very resource rich, and then there are some other areas that maybe aren't so much. I think even if you look at counties that have a lot of resources available, sometimes it's the barriers or the gaps are in them being accessible. So kind of like Dr. Oleka was saying earlier, if you have a parent who maybe isn't able to take time off of work to transport their child to a specific appointment somewhere, then they miss that, and then it just kind of snowballs from there in terms of them being caught up in the justice system because they weren't able to make it to an appointment. So I know at least in Jefferson County, something that we've been doing is working, there's a committee out there, and we've been working to try to identify all of these different resources and people who would be willing to work with kids who either have already been involved in the justice system or who are at risk of being involved at the justice system, and making sure that like the court designated workers or law enforcement or anyone else who may interact with the child are aware of these resources, so that then maybe they can do the warm handoff instead of having a kid have to actually go through the justice system to be referred. I think there's still like opportunities for us to really do like a deeper analysis of where the services are in each county and kind of get a better understanding of where those gaps are, because I think then it would help us to be able to reach more kids all across the state instead of just in pockets of the state.
Representative, I think that's another great example of that cross-arena, cross-sector approach. He's not on the screen, so it's not fair, but I think the smartest person I know on this topic is Senator Wise. And I think what we've tried to begin exploring with him is, since a large number of these issues tend to be school referred, and the school referred data would suggest even more extreme racial disproportionality. Circling back, schools have enormous drawdown power to bring, even in the most remote school districts. And we've been working with Kentucky Association of School Superintendents, and they're all over this, where folks who need sort of Frisky 2.0, Frisky on steroids, with behavioral and mental health supports, again, there are genuine financial resources available. The idea of making that maybe a school-centric support, especially in more rural areas, we think could be a real lever to provide those services.
Thank you. And a quick follow-up, if I may. And I would be very interested in following up about that, because even in Jefferson County, even with the resources that are available, those dots are not being connected.
Right.
And so we're still looking at traditional incarceration, juvenile justice pathways for these kids, who, leading to my second question, all of the kids represented in these data points come to school with a host of issues, family issues, and I know I'm working specifically to try to get mental health care expanded for our refugee population in Louisville, because refugees come to the U.S. with an inherent sort of set of traumatic experiences, and we talk about those, but not necessarily what their kids have gone through, who are also entering the school system. And then also first generation, because that never really goes away. We just sort of expect folks to get up on their feet in a few months and then just figure it out, and any underlying trauma. But getting back to the economic security piece of it, I'm specifically interested in the housing, so rental versus home ownership issue, especially within the context of the rate of evictions that we've seen, or at least we've seen in Jefferson County this past year and a half, and what that impact has been on these kids in terms of, for instance, mental health that would lead them to get these complaints, or if there's anything you've seen that you can speak to with regard to that.
There isn't anything. There isn't anything that I've seen. I mean, that's something that we can look into, though, and circle back with you.
I think the data is one of those 1 year gap kind of a thing. So for us to, I assume what you're asking is because of the pandemic, because of the economic crisis, what level of homelessness or couch surfing. Again, I think the accurate answer is that we may have to wait another 6 months to get truly accurate data. Anecdotally, I think we all probably would agree where that's going, but I think the reason we don't have an answer is that answer's not there quite yet.
Mm-hmm. Understood. Thank you.
Thank you. Arwen Roberts?
Thank you, Coach Heverin. I really appreciate all the data that's in this kids count. I mean, it's a lot of good information, and of course, I think data is always very important to work from. And so my first question kind of centers around data in the area of the juvenile justice complaints and the disparities that are there. Is the data such that you can drill down and see, for example, is it an issue with a particular school district, a particular school within the district, a particular police department, so that resources can be focused in those areas? It is?
Yes, sir.
Okay, great. And then shifting over to the health access area, it sounds there's definitely been a lot being done on the access side for whether it's Medicaid or access for children to get health care. Are you aware of efforts on the provider side? And the reason I ask is because I know, for example, in Louisville, Norton Healthcare has taken some initiatives on its own in the area of health equity because of their leadership. But is there an effort with other hospitals or providers to try to, make them more aware of the issue, get them involved? I would think that most people who are in the healthcare field would want to make sure that children have access to health care, particularly those that are in the greatest need. So any information on that at all?
I can't speak for the hospital association or particular providers, but I know that it's important. We know we need access to coverage because that's the first step in getting that care that they need, whether you're a child or if you're an adult. But certainly, I think there's efforts that we all need to be working together. It needs to be a community approach. It needs to be legislators on board too, helping us get kids covered and getting families insured. And so to your point, yes, we certainly need all the partners at the table working together to make this happen.
I think I know it's easy to beat them up. A shout out needs to go to MCOs on that front. A couple of years ago, we got to partner with MCOs on the issue of vaping. And what we learned was the most effective way to curb vaping was peer-to-peer messaging. So we did a public information campaign, young people talking about it. Right now, we're hoping relatively soon that we're going to launch with collaboration with MCOs a youth voice campaign around vaccination. So we know currently there's a real gap in that arena. Lots of folks have tried to communicate who have not been used to communicate with young people, and we have found that peer-to-peer communication really powerful. So I do just want to say that that's an arena where I think MCOs are collaborating and understand those gaps in care have to be addressed.
Mm-hmm.
Thank you.
And then I believe Senator Westerveld has another comment. Last time, Whitney, or it's $5.
That's like what I have to pay when I mention Rotary at my Kiwanis meeting. Fine. Whatever you say, Madam Chair.
Thank you, Whitney.
Thank you. I wanted to comment. Representative Kulkarni said something that jogged my memory. A few weeks ago, I had a chance to go to there was a cross-disciplinary event between the National Conference of State Judges and the National Council of State Legislatures, NCSL and NCSC. And it was about young adult population, so the 18 to 25 group. We talked a lot about juvenile justice in the same process, but to make a long story short, one of the takeaways of the Kentucky team, two judges and Senator Carroll and I had a chance to sit down and just sort of go through a list of things that we thought were issues or were problems that we could identify or we couldn't identify. One of the takeaways and action items, and I've already put out a request, and I'm happy to share it with members of this committee and certainly Representative Kulkarni among you. I asked for various agencies of state government to give us an inventory of the programs we have. One of the things that we thought we could start with was to identify what programs we have, exactly where their service footprint was, because I deal with this sort of policy work all the time, but I don't know what. I'm familiar with some of the more high-profile services in Jefferson County. I'm certainly familiar with them in Christian and my Penny Ryle and Barron River area. But outside of that, I have no idea what's going on in other parts of the state. And I think it'd be helpful to have that. So as soon as I have it, I saw your suggestion is right on the nose. So as soon as I have those reports back from the various state agencies, I'm happy to share that and broadcast that to folks, because I think it's something our judges need to know, our prosecutors and defense attorneys need to know. Our service providers know it, but those circles don't always communicate. Thank you, Madam Chair. Last time, I'll shut up. In fact, Senator Jimmy Higdon is demanding I join a Zoom with him right now, so I will lead this meeting.
We've got to have some type of fun around here, Whitney. It's a very dark time as we prepare for session, so thanks for letting us have a laugh. Thank you very much for those comments, Senator Westerfeld. I know you've been a huge advocate on that, and your comments are greatly appreciated. And I'm going to let it wrap up. I don't see any other online members wanting to speak, so I will let Co-Chair Givens wrap up on this.
Co-Chair Heverin, thank you, and again, a wonderful conversation, great questions, great dialogue. I'm gonna end with a couple of thoughts and then a question for us to think about. And Terry, you may want to speak to the question. First of all, a shout out. Thank you for the work you do, and specifically for the shout out you've given us as a commission for our members that do have a printed copy on page 5. Terry, that means a lot when you write a paragraph like, "We are heartened by the potential of the newly created Commission on Race and Access to Opportunity, made up of a group of bipartisan legislators and citizen members with the charter to study disparities and identify solutions to advance equity across education, child welfare, health, economic opportunity, juvenile justice, and criminal justice." In this year's book, we dive into data by race for each key area of child well-being to help inform the Commission's work and identify some clear policies that would lead to more equitable outcomes for Kentucky's kids. Thanks for acknowledging what I think is very important work that we're doing here, and thanks for lending the talents and credibility of your organization toward that work. Now, that it made you feel good, I'm going to follow Mr. Roberts' directive that we drill down, we dig a little, we twist and put some pressure in some places. And I want to go back to the conversation around the age 12 suspension question, conversation sort of thing. You and I have had lots of conversations over the years about lots of policy, and I've come away from every one of those benefited in some fashion. And one of those we wrestled with for a couple of years and was intrigued that, again, it's one of those I feel differently. And members are going to misconstrue what I say, and I don't intend for that to happen. We had a long, robust conversation some years ago about corporal punishment. Ban it. Senator Givens, let's ban it. Let's absolutely ban it. And I wasn't strongly opposed to banning it, but my conversation with you was around the question of how many counties are still doing it? What's the culture in that county? Is this a flag that you're wanting to say, let's just prevent people from waving the flag? And so my pushback was along those lines. And so on this conversation about education and as it relates to the discussion about suspensions, I had those pages marked in the book because I had a very specific, here we go. I'm around page 33, 30, 32, 33. If you got a copy of the book there, open
Yes,
it
sir.
with me. And if I do a quick count of pages 32 through 37, 1, 2, 3, 4, 5, 6, I'm going to bet you've got 172 districts listed. That's how many districts we have,
Yes,
school
sir.
districts. So you've got 172 districts listed. I did a quick count of the number that have a green check, meaning a positive change since 2013 as compared to 2018-19. The green check number indicates that these districts are moving toward fewer out-of-school suspensions on a rate of per 100 students enrolled. I think the number out of 172, I came up with only around 40 that are moving in the right direction, meaning we have a vast majority of students that are vast majority of districts that are suspending more students today than they were in 13, 14 on a percentage basis, if I'm understanding it right. I think the deeper, bigger, more helpful question from a policy perspective is why? And I'm not asking you to answer it now unless you have a feel or a sense, but have we probed why we have more suspensions?
Yeah, I actually have a fairly strong hypothesis, and I have real hope that the red will turn to green. And it is because of what I still regard as one of the seminal pieces of work that the General Assembly has done, and that is that School Safety and Resiliency Act. I don't think it's unfair to believe that an act that was that landmark and profound has not trickled to all 172 districts yet. But when you get, at least my understanding is when we get underneath the excellent work that the late Representative Carney and Senator Wise did on that, they were about building supports for a culture of resiliency in schools. As a principal, when I suspended a kid, I knew I failed, but I also knew that in many ways I didn't have any alternatives to that. I believe that what you all have begun to do is to give principals tools so that the default is not an out-of-school suspension. Again, we talked, I think, last session about it. I would love, for instance, I think there's an interesting middle ground between state mandates and local control, that if, for instance, there were categorical budget items around resiliency, not mandated, but if you were going to spend that money, it was going to be on this range of options, knowing that all those superintendents, and I hate to beat this drum again, but to me it's so powerful, knowing that for every dollar you all allocate for resiliency, they can get 3 more. I think that those kind of resources, whether that's school social workers or school therapists, as I mentioned, the potential to expand the good work of Friskies is there. So I actually think that is that canary in the coal mine. I would love for those red X's to be stimulations, with all due respect, for the General Assembly to continue that good work. I think that whether it's been juvenile justice or child welfare, you all have built a good track record that you start with landmark work and keep building on it. So, in my mind, and I don't mean it's an easy solution, but I think the foundation to change that one data point has already been done with that School Safety and Resiliency Act. Now it's thinking about how do we tweak it, deepen it, and expand it.
Great response, as always. And let's watch and see. If we don't get a response there, then maybe we need to dig and scratch and find and see what. And the goal is not to name and shame districts.
No,
that's not the
absolutely
goal.
not.
The goal, if we have green checks, some districts are doing better. They're suspending fewer students. What's going on in the good districts that's not going on in the others? So, again, thank you all very much for the work you do. We're going to spend the last 45 minutes or less wrapping up a great year. You're welcome to stay with us and listen. Again, we appreciate your dedication and your work in this space.
And we appreciate and we're humbled by the opportunity to be before you today. Thank you so much.
Thank you.
Thank you.
All right, members, we have purposely scheduled a period of a few moments before we end the last meeting of our first interim together. We've purposely scheduled a few moments for us to have a dialogue about what's worked, what's not, what we hope to see coming at us as we start the early groundwork for the interim of next year. And I'll start with some thoughts on that, as I've had some of our staff put together a number of names of groups and individuals that have sought the chance to be presenters, and we simply ran out of time. I have to say, Co-Chair Heverin, one of the things that I found most interesting was the number of people that were anxious to come and present before the committee. A chance for them to be at the table, as this group, KYA just was, and others. The chance to use this commission, very appropriately so, as a platform and a voice for the cause that they're advocating for. And so we currently are carrying forward 3 presenters, and I feel confident we'll have groups that have presented that wish to come back. I think one of the things I would encourage all of us that are members of the commission to be ambassadors to groups, be ambassadors to entities. If you encounter someone who you think may have a presentation that's worthy, encourage them to reach out to committee staff. We're going to work on putting together a list of presenters between now and the 1st of May. And we will certainly start scheduling folks early in the interim for purposes of coming in and presenting their conversation points. Co-Chair, any thoughts on that you wish to add before I move on?
Just to kind of follow up with that, I think, you don't have to be a member of this committee to request a speaker, or if you have any suggestions. I believe that Co-Chair Givens and I have both had meetings with a few House members within the last week, asking, just kind of giving some ideas and saying, hey, I think this would be a really good group to put in front of you all, if you all would consider it, and here's why. So if you are a legislator, senator, or representative, please feel free to email us, or members of this committee or advocates. Please shoot us an email and let us know your interest. But a reminder, when we do have groups come to speak, we don't want to just hear complaints. We want to also have solutions. I think that the advocacy groups have a unique perspective. So make sure to come with solutions, too, of what could actually be some policy for this commission.
All right. I'm going to read again very briefly the one-sentence charge found in the legislation of Senate Bill 10. Specific to the purpose that we're here for, the purpose of the Commission shall be to conduct studies and research on issues where disparities may exist across the sectors of educational equity, child welfare, health, economic opportunity, juvenile justice, criminal justice, and any other sectors that are deemed relevant in an effort to identify areas of improvement in providing services and opportunities for minority communities. A very specific charge. We've taken a first interim swing at it. What have we done well? What have we failed to do? What do we need to be focused on improving? Thoughts?
We'll go ahead and open it up to members. OJ, it seems like you're at the top of your seat.
I do have a couple thoughts on this. I think particularly what we have done well, that we've been open to hear different perspectives. I think that the spirit of this commission, as having been one of the folks that was a big advocate for it outside of government, was that we would do just that we would be bipartisan in the approach to try and look at data and figure out how they can be useful for us coming up with solutions to some pretty challenging issues. I think that we've done that. I think we've done that really well, and we've been open to those ideas. I think what we could do better as a group is twofold. One, and perhaps this is already being done, and forgive my ignorance on it if it is, I think one, what we could do is provide additional guidance to our presenters in terms of not only the charge of the committee, but to Chairwoman Hevron's point, to be very explicit about, one, the issue that they're trying to tackle, the data that demonstrate that there is an issue, but then third, and I think most appropriately, provide real solutions. Because it's one thing, I think, for this particular body, whether you are a legislator or a citizen member, to hear a lot of information and to ask good questions. That's important. But ultimately, at the end of the day, again, as Chairman Givens read in terms of the charge, there's a responsibility here for the commission to conduct its own research, and I think that you can do that by having very clear questions that you provide answers to in terms of presenters. The other thing I would say I think that we could do better is, in fact, figuring out what that might look like from a policy perspective that the General Assembly could then potentially review. It's not listed in the charge of the group to come up with policy answers. I'll be the first, I guess, today to say that these answers don't always have to come from government. In fact, most of them probably won't. But I think the ones that could, if it is an example like this threshold question, I think there is an opportunity there for the General Assembly to seek to address it, at least to discuss it in a way where it can be litigated, I think, with the full body. And the last thing, and this isn't to anybody who's present, so it might fall on deaf ears, but I think what we can do better in the interim next year is to be present. Chairwoman Hevron mentioned this last time, and I know I had to miss one meeting, but I may be speaking out of turn here, co-chair, so forgive me, but I find it quite remarkable that last year we could make a big deal as a Commonwealth and make a big push for the importance of racial justice from a bipartisan perspective, and to put in a lot of work with the General Assembly to push this particular commission and all the challenges that it went through, all the different iterations. And so regularly we have people just not show up. with the opportunity to be present virtually, as many folks have taken, the opportunity to be present in person, as many folks have taken, I don't understand why somebody would take an appointment to this particular commission and then just choose not to be here. And again, I'm not a co-chair. I don't work on staff, so I presume many folks who aren't present and haven't been have good and legitimate reasons. But I just think it is important for us, the folks who care about this particular work, again, advancing the opportunity of all people of every race in Kentucky, this commission looking at it explicitly for minority communities. If we say that that's what we're for, and particularly if we have complained that the state hasn't done it, and you have the opportunity to participate in a commission whose specific and explicit purpose is to do that, and you don't show up, that's a bit of a problem. So I think for people who have been appointed and who don't participate, I think that you should ask yourself the question if this is in fact what you want to do, because I'm sure there are other folks who want to serve. And so if that is not you, you should make room for others who will do the work.
Thank you.
Other members, other thoughts?
I would like to,
Please, Senator Berg.
I would like to speak up if possible for just a minute. First of all, I do want to say that being assigned to this committee, I felt that it was really an amazing opportunity to be educated and to become hopefully part of the solution instead of part of the problem. And I really, really appreciate what we've listened to and what we've done, and the questions that are being raised, maybe not answered, but at least asked. And one of the things that I keep thinking from my perspective, and this is very personal for me, that I would like to see some discussion on is the increased risk of juvenile gun violence throughout the state. And this is not just an urban problem, even though it may be particularly an urban problem, but you know, I've been practicing in both urban and rural settings for many, many years, and the amount of real serious violence that juveniles are perpetrating and having perpetrated on them has just increased dramatically. And I would really like us to be able to discuss that, even though nobody in Kentucky wants to talk about guns. I really think we need to, at some point, bring this question to the table and look at it. And thank you.
Senator Berg, thank you for the input, and I would encourage you as you travel the course of the next few months, if you have a presenter that comes to mind that would be a presenter to come and talk with us about this issue. Obviously, we would prefer someone knowledgeable and skilled and capable and talented, and to the degree that, look, all of us have bias on every position we take. We wouldn't take a position if we didn't have a bias in one direction or another. But a factual presentation by a group with limited bias for purposes of us to promote policy, I think they'd be welcome here. Certainly get their name submitted to the staff, and we will take a look at them for the next interim.
Thank you. I have some groups in mind that I would happily recommend. Thank you.
Very good. Any other members with any thoughts before we wrap up?
I have a few. And this is more of just kind of as we look at 2022, not necessarily things that we can do better, but things I would like to see us be able to incorporate. Something I've taken notes on from our very first meeting is is our opportunities that members could have. Something I feel like I really like to do is be a connector for people. And so if there are different groups or associations that we need to be connected with, I would like to be part of that as co-chair. And so something that came along was when AOC came, the Administrative Office of the Courts, they talked about specialty courts. Well, a lot of times we've not, maybe members of the community haven't had the opportunity to go and sit with teen court or a specialty court. And so I have reached out to Laurie Dudgeon, the executive director of AOC, and mentioned that to her. If you want to do ride-alongs with our state troopers or our local police officers, I think those are unique opportunities. Something that we talked about was really allowing us to empathize. And so stepping out of our comfort and understanding. And I think that's for a lot of things. And so that's something I would like to be a connector for members on this commission. If you would have interest in any of those things, please reach out to me, and I will try to help facilitate that, because sometimes people just don't know who to go to. Something I would also like to do for 2022 is come up with an inventory of what Kentucky already has in place for for race and access to opportunity. What do we already have that's just not being implemented? I had this conversation earlier with this commission with House Bill 212. We with the help of the Anti-Racism Kentucky Coalition, we did maternal mortality. And, I asked for race, income, and geography to be requested data in statute. Well, then I mean, with CHFS, and they weren't going to do that because they don't have income. But I was like, well, can we do Medicaid versus non-Medicaid? And they said yes. So, sometimes it's just following up. So what do we already have in place that's not happening? Sometimes as a legislature, we pass bills, but we don't necessarily follow up on them. So taking a collective look at that. And then really taking an opportunity to focus on access to opportunity. I think in the KYA presentation, something that really stuck out, and it's a conversation I've had with many people over the last few years, is what is the difference with poverty in Eastern Kentucky and with the West End of Kentucky? And I think a big part of that is access to opportunity. Now, there's a lot more that we can delve into with that, but I think that's a great start. I know Representative Kulkarni has got some unique experiences we've talked about with access to opportunity. So I'd like to see us focus a little more on that, because I think that's a big part of it. And before we wrap up, I really just want to thank our staff, Alicia, for all the work that you all do. This has been, and Dalton Workman, thank you for on the Senate side. We greatly appreciate it. Without our staff, this would not be as smooth running as it has been. And I appreciate that. And I appreciate all the opportunity to serve with Co-Chair Givens as well.
Co-Chair Heverin, thank you, and wonderful closing thoughts. I'm going to share one or two of my own very briefly as we wrap up what I think has been a good interim. First swing at this, and certainly looking forward to future swings and future efforts. I want to reflect on her words and reinforce the appreciation of our staff that has provided such able assistance to us in navigating something that, when you were asked and or coerced to sign on for, this is not one of those things that people say, hey, this is going to be a hoorah, hey-rah kind of thing. And I think we've done some good work. We have room to do better work. We have room to probe deeper. We have room to investigate things at a more in-depth approach than we've taken. But first out of the gate, this has been good. This has been a good conversation we've had. And two quick thoughts as I close after those thoughts. Probably the moment for me that was most striking as I look back over a list of the meetings and the dates and what we did. Olga McKissick with the Owensboro Group, Western Academy, and the passion and the presentation that she made sitting there at that table, I was struck by that. And I was struck by the reminder that all of us every day, legislators, non-legislators, citizens, business owners, moms, dads, all of us every day have a moment when we can influence someone in some way. And she's purposely structured a program that on the Saturdays once a month or however often it was, she's purposely structured a plan to make a difference in kids' lives. And I thought about the starfish, and you're not going to save them all, but you're going to make a difference for that one starfish. And I'm confident that every one of those kids' lives that she touches there in Owensboro is a profound impact on that community, and definitely a profound impact on that one person's life. The other last quick thought I'll share comes from a conversation I had this morning with my daughter. My 24-year-old daughter, Hannah's in for Thanksgiving, and I don't really think that for a moment she likes my coffee better than any other, but she always asks me to make it for her that those mornings that she's home. And so it's not often that I get to make coffee for her. And so I was sharing with her what I was going to be doing today in the Commission on Race and the work we've done. And she's very insightful, and I was running late, and she said, Dad, I've got some thoughts. You need to sit down and listen to me. Doesn't matter that you're running late. Sit down here and listen. And this younger generation, they have a different approach and a different take and a different mindset in a very positive, refreshing way on the sort of conversations that we're having here and that I hope we can have. She was insightful in saying, Dad, I'm a 24-year-old female coach in a Division III volleyball program, and I see it every day as a female. I see it happening to my peers that are of a different race. Dad, you don't see it. Dad, you just don't see it. And you can't understand it. And I said, well, Hannah, help me to be better at it. Help me to understand it better. And I shared with Co-Chair Heverin, this is not a defense of my inability to understand. It's an acknowledgement of my human failings when I say all of us have life experiences and walks that teach us different cultural, social approaches to things. All of us are the product of those life experiences. And when my daughter asked me to set those aside, I said to her this morning, I said, Hannah, I'll be glad to try, but you've got to give me grace and space and time as I practice setting aside the things that life has taught me and viewing the world differently and trying to understand if I have bias in me that I don't see, then please teach me that. Do it in a way that you show me grace in that teaching. And I think we've done that for each other in the conversations we've had here. I look forward to those conversations going forward. Thanks, and everyone have a great Thanksgiving. Would you